Yemen reported its first case of the novel coronavirus on Friday as aid groups braced for an outbreak in a country where war has shattered health systems and spread hunger and disease. The news of the laboratory-confirmed case came after a nationwide ceasefire prompted by the virus pandemic began on Thursday. A Saudi-led coalition fighting Yemen's Houthi movement announced it would halt military operations for 2 weeks, though the Houthis have yet to agree. The case was diagnosed in the southern oil-producing region of Hadramaut, an area controlled by Yemen's internationally recognized government, the Supreme National Emergency Committee said. The person was stable and receiving medical attention. A local official told Reuters the person was a Yemeni working in the small commercial port of Ash-Shir. If the virus spreads in Yemen, the impact would be catastrophic, its UN humanitarian coordinator, Lise Grande, told Reuters on Thursday, as the health status of at least half the population is very degraded and the country does not have sufficient supplies or facilities. Authorities ordered the closure of Ash-Shir port for a week for deep cleaning and instructed workers there to isolate at home for 2 weeks, according to a directive seen by Reuters. They also imposed a 12-hour nightly curfew in all Hadramaut districts starting from 6 p.m. Friday until further notice. Civil defense vehicles near the port were ordering people through loudspeakers to stay home, residents said. Today we heard that there's coronavirus and stayed home. May God protect the country and our families, said local resident Mazen Salem, a father of 2. The World Health Organization (WHO) said it was providing support to Yemen's health ministry. We are following the case and its contacts to assess the level of exposure, Yemen Representative Altaf Muzani said. WHO recently told Reuters it was working to provide Yemen with the ability to test thousands of patients. It has already provided 500 testing kits. Some 37 health facilities have been dedicated as isolation units. Yemen's 5-year-long war has killed more than 100,000 people and triggered a humanitarian crisis. Only half of its hospitals are fully functional and 18 million people do not have access to proper hygiene, water and sanitation, the International Rescue Committee says. Cholera, dengue and malaria are rife. Around 80% of Yemenis, or 24 million people, rely on humanitarian aid while millions live on the brink of starvation and are vulnerable to diseases. Ali al-Walidi, spokesman for the government's National Emergency Committee, told Reuters this week that in southern Yemen quarantine centers had been set up in Hadramaut, Al-Mara and Aden. He said the committee was requesting ventilators, oxygen tanks and hospital beds from the WHO in coordination with Saudi Arabia's King Salman Humanitarian Aid and Relief Center to be divided between areas under control of the Saudi-backed government and those held by the Houthi movement. The Houthis, who ousted the Saudi-backed government from power in the capital, Sana'a, in late 2014 control most big urban areas. They have set up a quarantine center at a Sana'a hospital and one in Sana'a airport. The United Nations is trying to set up virtual talks among the warring parties to discuss a permanent truce, a coordinated coronavirus response, humanitarian and economic confidence-building steps and resumption of peace negotiations. Yemen relies heavily on imported food, fuel and medicines. The World Food Programme said on Thursday it would have the aid it gives to people in Houthi-controlled areas from mid-April after donors cut funding over concerns that Houthi authorities were hindering aid deliveries. The WFP feeds more than 12 million Yemenis a month, mostly in Houthi areas. Houthi authorities have complained about mismanagement of aid programs by international bodies. A U.S. State Department official told reporters in a teleconference on Thursday that the onus was on the Houthis. We encourage them to, 1, join the ceasefire, and 2, to end their problematic humanitarian practices, said David Schenker, Assistant Secretary for Near Eastern Affairs. Interactive graphic tracking global spread of coronavirus, OpenTMSNRT.rs/3erus7 in an external browser. Closing parenthesis.